Hi everyone, this is Dr. Praveen Patil here. Today we are going to talk about the Jaloukavacharana. What is Jalouka? Jala Masayu Ritihi Jaloukaha. One which resides in the Jala, that is water, that is called as Jalouka. Raktamokshana is divided into two types, that is Shastrakuta and Ashastrakuta. Prachanna and Siraveda are example for Shastrakuta Raktamokshana, whereas Shrunga, Jaloka, Alabu, and Gatiyantra are example for the Ashastrakuta Raktamokshana. Coming into the indications of Jaloukavacharana. अवगडे जलोका स्यात् प्रच्छन्ने पिंडिते हितं सिरा अंगव्यापके रक्ते शृंग अलाबु तचिस्ते. When the doshas are deeply seated, that is avagada, then jaloka has to be used. If this is a pindita, that is localized, then prachanna. Angavyapake, generalized visheshan, then siravedaha. And when the doshas are situated only in the skin lesions, skin area, that is tvachistite, then shrunga and alabu are indicated. Coming to the other indications of Jaloukavacharana, Nrupaha, Ataya, Balaha, Ruddaha, Biruna, Durbula, Nari, Sukumara. So these are the other indications where Shastrakota Shastrakota Raktamokshana is contraindicated in those cases like Biruna, Durbula, Nari, and Sukumara. In those conditions, we can go for the Jaloukavacharana type of Raktamokshana. Coming to according to doshas, so Vata dosha disorders, the Shrunga is indicated. Pitta dosha disorders, Jalouka is indicated. And Kapha dosha disorders, Alabu is indicated. Coming into the another way of indications of Jaloukavacharana. Jaloukavacharana is having Madhur Rasa Pradhana, hence it is used as a Pittaja Vyadi disorders. Coming to the classification of Jalouka, Jalouka is classified into two categories by Sushruta, that is Sarvisha and Nirvisha Jalouka, and two categories by the Vagbata, that is Pum and Stri, and four categories by the Haritaka. So those are Indrayuda, Rohini, Kalika, and Dhumra. Krishna, Karbura, Alagarda, Indrayuda, Samudrika, and Gochandana. So these are the Sarvisha, that is poisonous leeches. And Kapila, Pingala, Shankamukhi, Mushika, Pundarika and Savarika. These are the Nirvisha Jaloukas, that is non-poisonous leeches. Krishna is having Anjana Churnavarna and Mahamastaka. Sarpakara is seen in the Karbura. Alagarda is having Mahaparshva, that is big size and hairy wrinkles on its body. Indrayuda has different colors on its body. Samudrika is having Davala Bindu Chitra, that is the flower like white spots on the body. And Gochandana is having Anumukhi, that is narrow mouth. Coming to Nirvisha Jalouka, Kapila is having Manashila with appearance, whereas the dorsal surface is Snigdha and the color like the Mudga pulse, that is greenish shade. Pingala is having reddish brown color and which moves very fast. Shankamukhi looks like liver and having sharp and long suckers. Mushika looks like rat and we having foul smell from its body. As name suggests, it looks like full blown lotus, that is mouth looks like full blown lotus and having the color of the mudga. Savarika looks like glossy lotus leaves and measures 18 angula in the length, and its medicinal use is advised in the lower animals. The Nirvisha Jalouka were available in Yavana, Pandya, Sahya, and Pautana areas. The maximum length of Jalouka has been reported 18 anguli. The big Jalouka may be used for the bloodletting in animals like horse, elephants, etc. For human being, 4 anguli, 5 anguli, 6 anguli pramana Jaloukas were preferred. Jalouka can be caught by holding the piece of wet leather in tank, streams, or where there are lotuses. There is another method of collecting the leeches, that is Jalouka. A fresh meat of dead animals or fish, or apply ghee, butter, or milk over the thigh of an animal or human being himself. Then stand in the river for some time at the thigh level of water. By this, Jalouka gets attracted and will catch the place. Then remove them from the skin of the person with the application of the Saindhava Lavana and collect it. The best season to collect the leeches is Sharad Ritu. Then after the collection of leeches, they should be kept in a wide new earthen pot. The pure water with a lotus should be filled with the pot. Feed the leaf, feed with the leaf of the lotuses plant, shaivala and powder of the stem of the small plants and dry meat. So on every seventh day you have to change the on every third day there is a need of changing the water, and every seventh day you need to change the pot, whereas Vagbata has mentioned to change the pot on every fifth day. Jaloka is smeared with the paste of the haridra. Then Jaloka is kept clean in clean water for a period of 1 muhurta, that is about the 48 minutes. By this procedure, leeches become activated and then get rid of the exhaustion. And after that, we can use it for the application. Application of Jaloka. The patient is made to sit or lie on the bed. The area of the body where the Raktamokshana is planned, that is to be dried and allowed to bite by Jaloka. Jaloka will bite on the skin and suck the blood by itself. If Jaloka does not suck or bite the skin, a drop of milk or blood is shed on the surface or a small prick is made. In spite of all this, if the Jaloka does not suck, then another Jaloka has to be taken for the Raktamokshana. It faces appears like a hoof of horse and it raises its neck. By this can be understand that it started sucking the blood. As soon as Jaloka starts sucking, wet white gauze should be covered on its and leaving the facial region. Once it starts sucking, it looks like Ashwankur Vadanan, that is the hoof of the horse. As soon as Jaloka detaches from its patient body by itself or by the force, a paste of Tandula Kandana is to be applied over the body and a mixture of Taila and Saindhava Lavana is smeared on its mouth. Then, with the help of thumb of the index finger of the left hand, tail and end of the Jaloka should be caught by the body of the Jaloka and is squeezed with the fingers of the right hand towards its face in the reverse direction. This maneuver induces the Jaloka to omit the sucked blood. This is continued until the signs of proper omana are achieved. I repeat, with the help of thumb and index finger of the left hand, the tail has to be caught, and with the right hand, it has to be squeezed in the reverse direction. After Omana, if the Jaloka moves in the container actively, then it suggests that it's a proper Omana has happened. If the Omana is not properly takes place, then Jaloka get the disease called Indramada or Raktamada. Hydroneria are commonly called Indian cattle leeches, belongs to class Hydroneae, which contains more than 300 species of leeches. Common Indian species are Hydroneria granulosa, Hydroneria viridis, Hydroneria javanica, and Hydroneria menelensis. Among these, the most commonly used leech is Hydroneria granulosa. Leech has 33 segments in its body and two ends. One is sucker end, another is the post sucker end, that is the mouth end and the anal sucker. Leech are going to act by reducing the congested blood, like reducing the venous congestion and all, and as well as giving the saliva or relieving the saliva into the tissue, which has hirudin in its saliva, Kalin and disbilase and hyaluronidase. So these are the few important enzymes which are there in the saliva of the leech. So this is about the small discussion about the Jaloukavacharana. So if you like this video, then kindly subscribe to the channel and press the bell icon. If you like to have such kind of video, then let me know in the description box.